Health Assessment Abdominal Exam, Jordan Alexander. Hello, my name is Jordan Alexander. I'm going to be doing an exam on your abdomen. Okay, so I'm going to have you lay down. I'm just going to lift your shirt up slightly. So first, I'm just identifying symmetry of the abdomen. I'm looking at the umbilicus, and there's no bulging present midline to the xiphoid process. Looking at the skin, there's no scars, rashes, lesions, no dilated veins, and no striae. Also, contour is slightly rounded, no protuberance or scaphoid present. There's no visible peristalsis or aortic pulsations. Right now I'm going to auscultate, listen to your bowel sounds. I'm going to go mid-clavicular line in the upper and lower quadrant. My bowel sounds are normal active. Now I'm going to listen for friction rubs. First I'm going to listen to your liver. First I'm going to listen to your spleen. So I'm going to feel the last 6 rib, and then back. No friction rub. I'm going to listen to the liver. No friction rubs. Now I want to listen for bruits. So first I'm going to listen to the abdominal aorta, which is between the xiphoid process and the umbilicus. No bruits. I'm going to listen to the bilateral renal arteries. Go about an inch lateral on both sides. And go down to the umbilicus about 2 inches. Listen to the iliac artery. No bruits. And listen to the femoral artery. So I'm going to pull your pants down just a little bit, okay? No bruits present. Thank you. Right. And then I need to listen to venous hum. So I'm listening to the epigastric area and then just right over your umbilicus. Okay. All right. No venous hum. Right now, I'm going to percuss the abdomen. So first, I'm just gonna go through the 9 locations and listen for tympani. Okay. All right. Listen. Everything sounded normal, tympani present, no rebound, resonance, or marked dullness. Right, now I am going to percuss the liver. So I'm going to need to go from right below the breast, and I'm going to percuss until I hear marked dullness, and then I'll have you put your finger where I hear it, and then I'm going to go from below and up, and I'll have you put your finger there, and I'm going to measure it, okay? So, just lift that up for now. Okay, then put your finger right here. Just one finger. Good. And put your finger here. Centimeters, we have about 9.5 centimeters. Okay, you can move your fingers. Now I'm going to percuss your spleen. So I'm going to actually have you turn onto your right side. Okay, thank you. Perfect. All right. So I'm feeling 6th rib. I'm going to move to the axillary line. Oh, you don't have to move, put your finger. That's done. And have you take a deep breath in. Okay. Right. Now I'm going to palpate your abdomen. First, I'm just going to do nice light, abdomen soft, no tenderness. Feel any bulging. And then do deep, 2 to 3 inches deep. Any pain, I press, trying to avoid the abdominal aorta. Okay. And now I'm going to palpate the liver, hook technique. And then the spleen. So again, actually you can stay just like that. Press down here. Take a deep breath. Okay, I feel it. Spleen soft. Normal size, no swelling. Okay, good. Thank you. All right. Now, and then I'm going to palpate your kidneys. So this is where I'll have you sit up. Good. This. Get your shirt up a little bit. Feel for this 12th rib. Feel your spinal cord. And then here's the space here. And I'll percuss that. Palpate kidney. The other side, 12th rib, spinal cord. Here's the costovertebral angle is what I'm feeling. Your kidneys. Any swelling, any pain when I squeeze? No. Okay. Kidneys normal size, no swelling. Okay. Now I'm going to check for costovertebral angle tenderness. I'm going to percuss that area that I explained. 12th rib and the spine. Any pain when I do that?
No.
Tympani heard bilaterally. All right, now I'm going to test for ascites. So again, I'll have you lay down. So here I'm going to tap on your, percuss your abdomen at the umbilical and then move outward and upward. Okay. I'm listening for dullness that moves. No dullness, ascites not present. Now we're going to do a test for appendicitis, okay? So first I'm going to put some pressure on your left lower quadrant, and I'm going to lift up. I want you to tell me if you feel any pain in your right side, okay?
No.
No? Okay, good. All right, so that is the Rav Singh sign. And we're going to do the So Is sign. So Is sign, what I'm going to do is I want you to move your knee towards your chest while I put my hand on your right thigh. Okay? You try to move your... Good? Any pain in your right side? Okay. And then I'm going to have you bring your knee to your chest. This, and then internally rotate it. Any pain in your right side? Okay, good. All right. Yeah, so that is the obturator sign. All of them were negative. No presence of, no concern for appendicitis. All right. Then the last test. This is testing for cholecystitis. This is called the Murphy sign. So what I'm going to do is I'm going to palpate the angle of your liver, and then I'm going to have you take a deep breath. So I'll tell you when to do it. So I want you to take a deep breath. All right, any pain?
No.
You can let go. You can release. All right. Okay, so negative Murphy sign. That is the end of my assessment. Thank you.